All right, so my name is Beatriz Jimenez Cadilla, and I'm a fourth-year pharmacy student at University of Wisconsin-Madison School of Pharmacy. And today I will be talking about medications used to treat common chronic disease states. First, I would like to mention that the tools and information in this presentation are provided to assist a community health worker in identifying medications commonly used in the community, promoting safe medication use and adherence. This information is not to be used as a substitute for professional training and judgment. An outline of what we'll be talking about today. First, we will briefly talk about medication safety and medication adherence. Then we will discuss common disease states in Wisconsin and common maintenance medications used. So medication safety. You may have received additional training on medication pathways, but I have included this slide in this webinar as a quick refresher. These are questions you can use to identify a patient who is not taking their medication safely. So first question addresses health literacy. So do you know what each of your medications is for? The third and last question asks about adherence. So do you always remember to take your medications as prescribed, or do you use a tool to help you remember to take medications? And then the one before last asks about safe medication disposal. So do you dispose of your expired medications? When you complete home visits, it would be very helpful to ask your clients to bring all of their medications, including over-the-counter products and herbal supplements, medicated eye drops, ear drops, and ointments. How can you help as a community health worker help promote medication safety? Ask these questions above, and if your client answers no to any of these questions, refer them to a pharmacist. Once you identify your client's medications concerned and refer them to a pharmacist, we will collect an in-depth medication history and identify areas where the client has misinformation or could benefit from education. And then we educate the patient. So adherence promotion. Adherence is defined as taking medications as prescribed or intended. There may be multiple reasons why someone does not take medications as prescribed. So someone very smart came up with this SMRF model that describes different barriers that can cause a person to not take their medications as they should. So the first one is system. So transportation. Does the patient have a pharmacy close to their home, or do they have to drive 30 miles to the closest pharmacy? Do they have a car to drive that far? So that's the first one. The second one is motivation. So maybe they don't know the importance or the benefits of taking their medications, or they worry about side effects. And the third one is understanding. So they don't know how to use a medication device, such as a blood pressure monitor or a blood sugar meter. And they might not know what the medication does or understand what does diabetes or hypertension mean. So why would they take a medication for something that they might not feel any symptoms for? Unable to read label or information is another barrier for understanding. So for recall, forgetting to take medications or needing to take medications multiple times during the day. And financial, so medications are too expensive or no prescription insurance. There are questions that you can ask to help identify clients with barriers to taking or getting their medications. So the first question assesses transportation. Are you having problems getting your medications? It can also assess financial too. Along with the second question, do you have problems paying your medications, or are you having problems getting them? How can you help promote medication adherence? Well, asking the questions above, and if your client answers yes to any of these questions, refer them to a pharmacist. And when you refer them to a pharmacist, what does a pharmacist do? Well, we can provide education and teach clients. We can also offer suggestions and recommend alternative medications. We can also enroll them in pharmacy services, such as medication adherence, bubble packaging, medication synchronization, among many others. Now let's talk about common chronic disease states. And I know you're very, very excited. So diabetes. The cells use sugar as a source of energy. Where did we get our sugar from? Liver, which produces glucose through a chemical pathway that I will not explain. And then food, which is represented by the donut, which is the main source of sugar, where we get the sugar from. So sugar travels through the blood and is delivered to cells that make up organs and tissues in our body. But here's the catch. So sugar is very big and it needs a door to enter the cell. The door has a lock that is only opened by a key that we call insulin. So insulin is also present in the blood, following the same roads sugar travels to make sure that is there to open the door for them. How polite! So as represented in the picture above, if you do not have a key or an insulin to unlock the door, sugar cannot enter the cells and thus stays in the blood and builds up. So the role of insulin is to help glucose enter the cells in our body so we can use the glucose for energy. So too much sugar accumulated in the blood can be toxic for our body, and it can cause serious issues, short-term and long-term. So where does insulin come from? Insulin comes from the beta cells in the pancreas, and it's represented by the picture here to the left. So the liver is the brown organ that you see there, and then the pancreas is the yellow organ that you see below the liver. So what is diabetes? This disease state is best explained by the key and lock analogy. So type 1, the pancreas, for type 1 diabetes, the pancreas is unable to produce insulin. So no insulin, no key. It means that the sugar cannot enter the cell. Thus, the sugar stays in the blood. And the high blood sugars means high blood sugars are toxic for the organs and tissues. So type 2, you have an insulin key but cannot unlock the cell door. So insulin resistance is also present and inability for the body to use the insulin. So the sugar cannot enter the cells and it stays in the blood. And again, it can reach toxic levels in the organs and tissues. So symptoms of diabetes. The normal blood sugar range before meals is between 70 and 130 milligrams per deciliter and less than 180 milligrams per deciliter after meals. But providers can individualize blood sugar goal range depending on patient-specific factors such as history of severe low blood sugars or presence of additional chronic disease states, recent illness or hospitalizations, and medications, etc. So some people can experience symptoms of low blood sugar even when they're normal ranges. And that is also very dangerous and we should avoid it. So this can be due to various reasons, such as that is your individual normal range. But it can also happen when people have had uncontrolled diabetes for a long time. So your brain resets and says, well, I guess these higher numbers are my new normal, and thus adapts to those higher numbers. So they can be at a normal range and still experience low blood sugar symptoms. And that is something you should also avoid and escalate to connect your client with a provider. So it's important to know that very high and low blood sugars put patients at higher risk for complications for diabetes and falls, especially if they have blood sugars that are very, very, very low. They can even go into a coma. And that is something we want to avoid at all costs. So some signs of high blood sugar are frequent urination, headache, drowsy, very slow wound healing, blurred vision, extreme thirst and hunger, or dry skin. So for diabetes treatment, this is a list of the most common medications used for diabetes. Note that this is not an all-inclusive list of all the medications we use to treat diabetes. I want to bring to your attention the classifications for type 1 and type 2. So type 1 uses insulin because people with type 1 diabetes mellitus are insulin deficient. So they need exogenous insulin, meaning insulin not produced by your body. On the other hand, the majority of persons with type 2 diabetes have insulin in their body. They just need help getting the cells to be more sensitive to it. So we use other types of medications. At some point, though, a person with type 2 diabetes may end up using insulin as part of their diabetes treatment, and that brings me to the next slide. So there is a treatment overlap between type 1 and type 2 diabetes. It is not rare to see a person with type 2 diabetes on insulin. However, there are very, very limited cases where you would use a type 2 diabetes mellitus medication, like metformin, on a person with type 1, on a person with type 1. So diabetes monitoring. A1C is a lab test that people with diabetes have every 3 months to measure how well controlled their diabetes is. Once diabetes is controlled, a doctor can choose to check the A1C every 6 months or so. Blood glucose monitoring is very important to help guide management of diabetes and understand if the disease state is controlled or not. Persons with type 1 need to check at least 4 times a day, after they wake up and before every meal. Both high and low levels of glucose are very dangerous, as I mentioned before. So people should be monitoring how frequently they are experiencing low and high blood sugars, and preferably documenting when they have happened. It helps guide the care team as to what activities or patterns or lifestyle factors during the day are causing those high and low numbers, and well, what can they do to manage and prevent them. So how can you help as a community health worker? This orange rectangle will continue to appear throughout the presentation. It just serves as a guide to help community health workers initiate talk about medication safety, monitoring, and adherence of specific, very complex disease states. Hypertension. So hypertension means high blood pressure, and high blood pressure is generally defined as disorder marked by abnormal elevation of systolic and diastolic blood pressure. As demonstrated by the image of the blood pressure meter on the left, systolic, or actually like in the middle, the systolic pressure is the top number and the diastolic is the bottom number. So these are there are multiple factors that can affect blood pressure, and it can be a disorder in the body, such as hyperthyroidism, tumors, or diabetes. Medications, stress, or salt in the food, caffeine, smoking, and alcohol, or a combination of all of this. High blood pressure can cause multiple complications in the body, such as vein ruptures, overworked heart that becomes enlarged, because the heart is a muscle, and if you overwork it, it will become enlarged. And it can also cause problems in the brains, and the eyes, kidneys, and blood vessels. So this slide is very dramatic, but I would like to briefly explain why I included this phrase of silent killer. A person with hypertension may not normally present signs and symptoms unless they measure their blood pressure. Thus, a lot of patients stop taking their meds because they believe they don't need them, or they feel it is not doing anything. So if you hear this from a client, escalate it and refer them to a pharmacist. Elevated blood pressure on the long term can cause heart attacks, aneurysms, and strokes. So symptoms of hypertension. Normal blood pressure range is less than 130/80 milligrams per mercury. The reason why there is a star at the end of the statement is because providers individualize blood pressure goals depending on patient-specific factors, such as age, history of cardiovascular disease, presence of additional chronic disease states, recent illness, hospitalization, or medications, etc. So having high blood pressure can be very overwhelming in the heart. As I mentioned before, it is a muscle, so if you overwork it, it will grow bigger and thicker. The problem with this is that less blood can fit inside the heart per heartbeat. So the heart falls into this vicious cycle of overworking. As I mentioned before, there are generally no signs and symptoms of high blood pressure, but if people experience chest pain, shortness of breath at rest, or retaining fluid, it could be indicative of disease progression, putting a person at a higher risk for a heart attack or a stroke. If a person experiences face drooping, weakness in one arm, difficulty talking, They may be experiencing signs and symptoms of a stroke, and they need to seek medical attention immediately. So on the picture on the right, you can see the FAST is a good mnemonic for that. So face drooping, arm weakness, speech difficulty, it's time for you to call 911. Hypertension treatment. So these are the common medications used to treat high blood pressure. Due to the complexity of hypertension disease state, it is very difficult to control someone's blood pressure with only one of these medications. So it is completely normal for a person to be in one or more antihypertensive medication because each medication class acts in a different part of the body. So the ACE inhibitors work in the kidneys, the beta blockers work in the heart. Most of the diuretics work in the kidneys, and you may note that some medication classes have generic names that end in the same way. So the ACE inhibitors end in the pril, ARBs end in the sartan, and beta blockers end in the lol. So hypertension monitoring and lifestyle. Persons with high blood pressure should monitor their blood pressure at home with a blood pressure monitor, such as the one pictured above. I have included a picture of the appropriate techniques for measuring blood pressure at home at the end of this PowerPoint presentation for your reference. Often, blood pressure readings at home obtained using a proper technique and a validated monitor are very preferred over the blood pressure readings that we take in the clinic in person because of white coat hypertension diagnosis. So white coat hypertension is literally that. You see someone with a white coat, like a doctor, a pharmacist, or a nurse, and your blood pressure rises. You can be worried about bad news. You can be stressed about, you're in a clinic, seeing a doctor, etc. So also something that I want to point out is that the presence of alarm symptoms may indicate that there is a possible complication of the underlying illness, and further workup needs to be done by a trained physician. So it's very important for you to refer them to the correct primary care provider or emergency room. So salt in the food can increase blood pressure itself, and it can also cause antihypertension medications to work less effectively. So salt intake should be limited to 1,500 milligrams a day for adults with high blood pressure. How can you help clients with hypertension? Asking them if they have been monitoring the blood pressure at home, and show me how they do it. If you identify someone that does not have a blood pressure monitor at home, connecting them with appropriate resources to either purchase one or have it measured free in community pharmacies such as Walgreens, CVS, or other supermarkets. Also, if they felt they're having alarm symptoms, maybe it's time for them to schedule an appointment with a primary care provider. So things like shortness of breath and with normal activity, like walking or going up the stairs, that's something that's a red flag. So hyperlipidemia or high cholesterol. Hyperlipidemia is also defined as high cholesterol. It means that the blood has too many fats. So cholesterol, lipids, triglycerides, these fats are very sticky, and they stick to the arteries, so also known as plaques. So this buildup is very traumatic, and it causes an inflammatory process that prevents oxygen from getting delivered to the heart muscle. So consequently, the cells in the heart muscle start to die, and such slow progressive blockage and dead tissues can induce a heart attack or a stroke, experience chest pain, myocardial infarction, among other complications. A stroke, though, it's when the blood supply to part of your brain is interrupted or reduced, depriving the brain tissue of oxygen and nutrients. So brain cells then begin to die within minutes. So again, this is a very dramatic slide, but I do want to point out that this is also a silent killer. Hyperlipidemia is also a silent killer because it is a slowly progressive disease that does not show signs and symptoms until a later stage. So you can detect high levels of cholesterol through a lab called a lipid panel, but the plaque buildup is very slow and progressive. So symptoms of hyperlipidemia, generally none, as I mentioned before. But you can also experience chest pain, cramping in the calves while walking, myocardial infarction, and stroke. And this is especially when you have disease progression. So the image on the right shows obstruction of the blood vessels, stiffness of the blood vessels, and that's something that we really want to avoid. Hyperlipidemia treatments. These are the most common medications used to treat high cholesterol. The statins are going to be the ones that you see the most, followed by Zetia, fenofibrate, and cholestyramine. So hyperlipidemia monitoring. Patients should keep their lab appointments to monitor their lipid levels, along with keeping a heart-healthy diet that is low in cholesterol and fats. You can also help clients with hyperlipidemia by reminding them to routinely schedule those appointments and make sure that their lipid levels are low. Also, you can also check for if they're missing a dose of statin, how often in a month, making sure that they're taking that statin every day. And that third question, have you experienced any muscle cramps, aches that are not explained by exercise? This is a very common side effect of the statins. So if you listen to someone talking about this type of side effects and they're on a statin, maybe it means that they're not tolerating the statin and you need to refer them to a pharmacist. For depression and anxiety, depression is defined as persistent feelings of sadness and hopelessness and lose of interest in activities they once enjoyed. It can be caused by many factors or a combination of multiple factors. But brain chemistry imbalance and stress, I would say, are the most important ones. And anxiety is defined on the next slide. So depressive symptoms. These definitions are made by the Diagnostic and Statistical Manual for Mental Disorders, also known as the DSM-M. And this is the depression criteria for major depressive disorder and depressive mood. So it has to be 5 or more of the symptoms mentioned above. 2 of them have to be number 1 and number 2 for at least a 2-week period. So depressed mood and low interest, and then any of the symptoms below. So for anxiety, generalized anxiety symptoms, number 1 and number 2 need to happen primarily. So excessive anxiety and worry. So we have this fear that something bad is going to happen most days for at least 6 months. And it's very difficult for you to control that worry. And other symptoms of anxiety can be restlessness, easily fatigued, difficulty concentrating, irritability, difficulty falling or staying asleep, muscle tension, etc. So these are the most commonly prescribed medications for anxiety and depression. Fluoxetine and sertraline are very common. Wellbutrin may be beneficial for someone with depression that also wants to stop smoking. The ones at the end in AM, like alprazolam, lorazepam, diazepam, those are often used for anxiety. They're known as benzodiazepine medication class, and it can be very, very addictive drug. Sorry. So depression and anxiety monitoring. So you start seeing a benefit in depressive symptoms after 4 weeks of taking an antidepressant agent. And it's very important for screening for suicidal thoughts and thinking about harming, themselves and other. And adherence is something that is very key. People that are depressed are often, not motivated and might find it hard to remember to take this medication every day. So how can you help as a community health worker? If you feel comfortable, you can ask about, have you had thoughts of harming yourself? In a month, how many times would you say you miss taking the antidepressive medication? Do you feel the medication is working? So now we're going to jump into heartburn, also known as GERD, or Gastroesophageal Reflux Disease. So there's a little door we have in the stomach, mouth, that should be shut after eating. People who have heartburn have problems closing that door, also known as the sphincter. Thus, an open door causes the food and all the liquid contents in the stomach to go back into the esophagus instead of staying down there shut. And that is the burning sensation that people feel in their chest and call heartburn. Laying flat, especially after eating, can make this even worse. So symptoms of GERD. It's very common to hear clients say, they have a burning sensation in the chest, they have chest pain. They might be very sensitive to some food and liquid, and we'll talk about this in the next slide. And feeling like they're bringing swallowed up food again to the mouth, or also regurgitation. Gas, feeling bloated. So some triggers of GERD is acidic food, such as spicy food, ketchup, citrus fruits like oranges. Also, stress can trigger heartburn. So this is an image with the most common triggers that can cause heartburn. Some GERD treatments. So you can find a lot of these products over the counter except Reglan. A lot of patients can still have a prescription for these products and have insurance cover the majority of the cost for this medication, especially if they use this every day. Omeprazole and ranitidine are very common. The ones that end in prazole are what we call the PPIs, or the proton pump inhibitors. And the ones ending in tidine are histamine 2 receptor antagonists, basically another drug class. So for GERD monitoring, we want to avoid heartburn episodes to decrease the risk of complications. Avoiding triggering factors is very key to avoiding these episodes. So keeping a diary to identify factors in daily routine and diet can help with this. So how can you help as a community health worker? Asking clients if they have a symptom diary. Have they been able to identify any heartburn triggers? Would you like someone to help you start a diary and identify these triggers? Have you tried elevating the head of the bed for nighttime symptoms? So when they're experiencing heartburn at night. Now let's jump into our asthma and COPD, which is our last topic. We're almost done. Asthma happens when the airways are always swollen. They're sensitive, and they're very sensitive to triggers such as pollen and dust. So when they are very sensitive and they're exposed to those triggers, the airways shut down and they cause what is called an asthma attack. But this happens episodically. COPD, however, which is chronic obstructive pulmonary disease, is constant inflammation and constant constriction of the airways, which causes limited air to come in. This is constant, so people with COPD have problems breathing all the time. Triggers. So all of these factors can cause an inflammatory response in someone who has a very sensitive airway. So things like pollen and food and infections and medicines can cause a trigger, an asthma attack. But smoking is most common cause of COPD. So you will hear people talk about their rescue inhaler and their controller inhaler. So let's talk about that. Albuterol, shown here as Ventolin, ProAir, are examples of rescue inhalers. It is the short-acting inhaler, so it's used when actively having an asthma attack or shortness of breath. They act very fast, so it gives a quick relief. So I think about Ventolin, it's like a vent. It opens the airways fast to allow more air to come in. The controller inhaler, however, something like Advair, it's a long-acting inhaler, so the steroid keeps the immune system controlled. It decreases the inflammation chronically, so it prevents someone from having an asthma attack, and so having to need the albuterol or rescue inhaler. All inhalers have special instructions for administration, which is why it is important to consult with a pharmacist to make sure that clients are not getting the full benefit, are definitely getting their full benefits of their inhalers. So this is the last slide, asthma and COPD monitoring. So we want to make sure that they're up to date with the flu vaccine and the pneumococcal vaccine. We also want to make sure that they have good inhaler technique, so they're using their inhaler optimally, and that they're using their controller inhaler every day, which is the one that they need to use every day to prevent them from having an asthma attack and needing to use the rescue inhaler, for example. And then avoiding risk factors. Although people that are on an underserved community might not have another choice and live in some areas specifically, so they can't avoid environmental factors like pollen, etc., and unless they stay at home. But things like smoking, well, that's something that we can avoid. So the image on the right, it says it's an asthma action plan. And it can come very handy, especially in patients who have problems discerning between seeking help or keeping an eye on their symptoms. So the green zone is okay, use the control medicines every day. Yellow is the caution area, so you need to monitor your symptoms to make sure that you're not getting worse. And then red means they need to seek medical attention, help now. So how can you help as a community health worker? Asking them, do you have an asthma action plan? Do you have access to an inhaler? Are you interested in smoking cessation services? How often are you needing to use your rescue inhaler? If they're using it more than 3 times, they might have their condition uncontrolled. Have you had your flu shot this season? Your pneumonia vaccine? Would you like to review your inhaler technique with a pharmacist? Those are things that you can ask. And that is all that I have. These are some references. If you have any questions, please feel free to email Carrie Trapskin, which is my preceptor, at this email. And I would like to acknowledge Pharmacy Society of Wisconsin staff, such as Carrie and Helene McDowell. So I included some pictures here at the end of the PowerPoint presentation just to help you identify hyperglycemia symptoms, how to handle low blood sugar levels, and I also included all the tables for the medications to help with the blood pressure technique, etc., just for you to take a look at. Thank you very much for listening in, and I hope you have a good rest of your day.